Hello friends, let us now learn some important points about antimalarials. These are the drugs which are based on plasmodial stage. Okay, antimalarials are divided based on the plasmodial stage. The drugs which are schizonticides, that is which kill the schizons, and there are drugs which are gametocides which kills the gametes. In the schizonticide we have hepatic schizonticide which will kill the schizons present in the liver, and we have blood schizonticide which kills the schizons present in the blood. So first we learn about gametocides. Gametocides include primaquine for all the species, chloroquine and quinine for Plasmodium vivax and Plasmodium ovale, and we have artemisinin in some. Artemisinin is also a gametocide, that too in some. Then hepatic schizanticides are primaquine. So because it kills the hepatic schizanticide, it is used for radical cure. Then we have tefenaquine also. Then we have blood schizanticide. These are very long list of drugs. So these blood schizanticides can be divided into faster acting drugs and slower acting drugs. These slower acting drugs are pyrimethamine and sulfadoxine, proguanil and tetracyclines. Whereas faster acting drugs include mefloquine, atovaquine, chloroquine, and these include artemisinin, lumefantrine and quinines are the faster acting drugs. So all these drugs are used for clinical cure. All these are used for clinical cure. Then the drugs that target erythrocytic plus primary liver stage of Plasmodium falciparum are, which will target both erythrocytic and primary liver stage of Plasmodium falciparum are atovaquine and proguanil. Best drug for gametocide is primaquine, and best drug for schizont is also primaquine. That is, best drug for both gametocide and schizont is primaquine. Then we have prophylaxis. There are two types of prophylaxis. One, we have causal prophylaxis and chemoprophylaxis. Causal prophylaxis will destroy the sporocyte prior to hepatic cell invasion. So these causal prophylaxis will destroy the sporocyte even before it goes to the liver. These include proguanil and pyrimethamine, because this proguanil and pyrimethamine are present in the blood. They act on the blood. Then we have chemoprophylaxis. These will destroy the merozoites released from the liver. They are given to the travelers going to the endemic areas. So the drugs in chemoprophylaxis are, these are short term drugs which is given for less than 6 weeks is doxycycline. Long term drugs which are given for more than 6 weeks is mefloquine. So these will destroy the merozoites which are released from the liver into the blood. Then let us now learn about the classification of antimalarials based on their action, mechanism of action. First, those drugs which interfere in heme metabolism. These drugs include lumefantrine, chloroquine. These drugs include lumefantrine, chloroquine, mefloquine, chloroquine and quinine. The drugs which interfere with folate metabolism include, these include dihydroxyfolate reductase inhibitors, which are pyrimethamine and proguanil, and these drugs also include folate synthesis inhibitors like sulfadoxine. Then these drugs, we also have free radical generation, some drugs which generate free radicals like artemisinin derivatives. Then Then we have the drugs which will interfere with mitochondrial function. The drugs which interfere with mitochondrial function include, we have atovaquone. Then the next important derivatives are, we have artemisinin derivatives. These artemisinin derivatives include dihydroartemisinin. This dihydroartemisinin is given perorally. This include artemether, which is oral or perrectal or IM, and we have artesunate, which is given oral or perrectal or IM. These artemisinin derivatives are not effective in hepatic stage. Some activity against gametocyte stage is seen. So because of that, they are not used alone, because they are not effective in primary hepatic stage. Then the artemisinin combination therapy is widely used. So in artemisinin combination therapy, we combine artemisinin with other drugs. So the drug artesunate, that is combined with mefloquine. Artesunate is given 100 milligrams BD for 3 days, and mefloquine is given on day 2 750 milligrams, on day 3 it is given 500 milligrams. Then we have artemether with lumefantrine. In artemether with lumefantrine combination, artemether is given in 80 milligrams BD for 3 days, and lumefantrine is given 480 milligrams BD for 3 days. Then we have artesunate and sulfadoxine pyrimethamine combination. This artesunate is given in the dosage of 100 milligrams BD for 3 days, and sulfadoxine and pyrimethamine are given in the dosage of 1500 milligrams plus 75 milligrams single dose. Now, this is about the main important drugs and classification. In the next class, we will learn about the treatment of malaria. Thank you for watching.